This segment in our preventative care series focuses on preventative health care that parents should be aware of when caring for their newborn infant. For new parents, this can be unsettling times. We are here for you, from the first breath until the first step and every step thereafter.
My name is Scott Shelley. I'm a physician assistant. I've been at Pronger Smith for 3 years now. I practice in internal medicine and pediatrics currently. I went to Rosalind Franklin University of Medicine and Science in North Chicago, Illinois, where I received a master's degree. My goal for this video today is to encourage all parents to have annual checkups for all children of all ages. Every year, 250,000 infants are born weighing less than 5 pounds. Low birth weights are a concern for both parents and for medical professionals. Low birth weights do lead to higher complications such as breathing complications, frequent illnesses, and less immune system response. These problems can result in lifelong medical problems, which we try to address early on in life to avoid these complications.
6 preventative health behaviors have been frequently identified as having the potential to reduce mortality and morbidity during infancy. 1. Breastfeeding until the age of 6 months. 2. No solid food until after 4 months of age. 3. Immunization against whooping cough, diphtheria, poliomyelitis, and tetanus. 4. The use of a baby carrier to restrain the infant when traveling in a motor vehicle. 5. Regular attendance at a healthcare provider for preventative health checks.
6. No cigarette smoking near or around infants or expectant moms.
Healthcare visits allow the doctor to educate parents about eating, sleeping, behavior, child safety, and good health habits. Even healthy infants should be seen by their doctor often during the first year of life. Visits typically take place at 1 or 2 weeks of age, and then again at 2, 4, 6, 9, and 12 months of age. During these visits, the doctor monitors the infant's growth and development by measuring the infant's height, weight, head circumference, and asking parents about various developmental milestones. Hearing and vision are also tested. The doctor also examines the infant for various abnormalities, including signs of hereditary disorders. In addition, a pediatric ophthalmologist may be consulted for premature infants. Finally, on many visits, the doctor vaccinates the infant against various illnesses.
Good job! A+. Immunizations are an important part of child care. These prevent lifelong communicable diseases. We always recommend all of our infants be vaccinated against these diseases.
Pertussis, or whooping cough, is a highly contagious bacterial infection that causes an uncontrollable, violent cough lasting several weeks or even months. Pertussis may begin with cold-like symptoms or a dry cough that progresses to episodes of severe coughing. The childhood vaccine for pertussis is usually given in combination with diphtheria and tetanus. Immunization authorities recommend that DTaP, diphtheria, tetanus, and a cellular pertussis vaccine be given at 2, 4, 6, and 15 to 18 months of age, and between 4 to 6 years of age. Diphtheria is an acute bacterial disease that can affect the throat, nose, or tonsils. It may also affect respiratory and/or skin called cutaneous diphtheria. Vaccines against diphtheria have made it very rare in the U.S. and in other developing countries today. The diphtheria bacterium can enter the body through the nose and mouth. It may also enter through a break in the skin. After being exposed to the bacterium, symptoms usually develop between 2 and 4 days. The vaccine remains necessary in case of exposure when infants are traveling abroad. Hepatitis B is a viral infection that can be acute or chronic and causes problems of the liver. Acute hepatitis B may cause liver inflammation, vomiting, jaundice, and rarely death. Chronic hepatitis B infection eventually causes cirrhosis and finally liver cancer. Hepatitis B is mainly transmitted through exchange of bodily fluids, blood, and passed on from mother to infant through birth. The Center for Disease Control and the Academy of Pediatrics recommends that all infants and children up to 18 years of age be vaccinated for hepatitis B. Thrush is very common in infants, but this fungal infection of the mouth and throat can be worrisome for parents. Also called candidiasis, thrush is caused by an overgrowth of Candida albicans, and this fungus lives naturally in the body. If not treated, thrush will continue to grow and may affect the digestive tract. The treatment for thrush is simple, and any signs of an infection should be looked at by doctors immediately.
Every infant needs routine health care. These appointments start soon after birth and progress on a monthly basis. This is very important for the provider to see and examine the child to be sure there are no abnormalities on the examination. We use these visits as screening tools to be sure that the child is truly healthy and growing appropriately. At Pronger Smith, we feel that preventative health is of utmost importance. We feel that starting at an early age and continuing lifelong helps prevent many disease processes and keeps people healthy overall.
Healthy birth outcomes and early identification and treatment of health conditions among infants can prevent death or disability and enable children to reach their full potential. At Pronger Smith Medical Care, we are fully prepared and equipped to provide you and your family with a lifetime of responsive and accessible care. Come in for a visit. We look forward to earning your trust. Thank you.